This is Back Talk by Successful Black Parenting Magazine, the most listened to podcast for parents by parents.
Welcome to Back Talk. Today, our expert guests are Dr. Sylvia Owusu-Ansah, who is the Assistant Professor of Pediatrics of a major children's hospital in Pittsburgh, and Chuck Davis, the founder and the principal data scientist of Bayesian, a provider of COVID-19 analytics to state and local governments. We are discussing the COVID-19 vaccine for Black families. I welcome you both to the show. Let me ask you a question about our community, Black community. For the most part, we're weary and suspicious, to say the least, about any government health initiative, which I'm sure you both can understand considering we've been experimented on from GYN experiments, I should say, to the most infamous Tuskegee syphilis experiment on Black men. So I keep seeing that referred to on social media. And because the vaccine came out so fast, many are resistant to being the first in line to get it, and they're taking a wait and see approach. So let me start with Chuck. Why should we, as the Black community, get in line to get this vaccine?
Yeah. By the way, thank you for having me. It's a great question given the history that we have with the medical establishment. The simplest way to answer that is because we're dying at greater numbers than our counterparts with this disease. For hospitalizations within the African American community, we're 3.7 times more likely to be hospitalized, and we're almost 3 times more likely to die of this disease. So, if there's anything that can help, this vaccine, and it's important. I know that we'll talk about this. There are actually 2 variants of the vaccine now. And a third that will be coming online shortly, and there are differences between them. But if we can reduce our hospitalizations and our deaths, we actually should be, arguably, probably first in line to get this vaccine.
Absolutely. Now, you said there is a third. I know about the second, which is supposedly easier to get, correct? And what is the third one?
So the third vaccine that is being considered right now is the AstraZeneca Oxford vaccine. Okay. And so there are different levels of efficacy. The first vaccine, the mRNA vaccine that we're familiar with, which is the Moderna vaccine and the Pfizer vaccine, those two, they roughly are about have the same effectiveness around between 95%, 94%, 95%. Is typically the numbers that are used. The AstraZeneca vaccine uses a different method to actually create the vaccine, and so far it's proving to be not as effective as the other 2 vaccines. But what you're trying to do is just get more vaccine out there, so that we can begin to be vaccinated. As you know, there have been close to 20 million or so, or close to 200 or 20 million vaccines in terms of distribution, and only 2 million or so doses actually given. So we're behind in terms of the amount of vaccine that we want to see distributed and actually going into people's arms. So it's one thing to create a vaccine. It's another thing to actually get it in people's arms where we'll do any good.
Okay, so we have Pfizer, Moderna, and Oxford. Okay, great to know. All right, I'm going to ask you too about the mutant strains at the end of the show. I want to know a little bit about that and if the vaccine is effective against the new strain that came out, which I kind of referred to by accident because I misunderstood your point, but now we know there are 3 different vaccines that will be coming out. Dr. Sylvia, why should we get this vaccine?
So again, thank you for the opportunity to revisit, to come back again. I'm very honored. I support what Mr. Davis is saying. For our particular community, first, I want to own the distrust. It's valid. It's real. You previously mentioned Tuskegee. Henrietta Lacks is another component of that. There's a list that can go on forever. But the reality is that COVID exists, it is real, and is affecting our community above levels of any other racial or ethnic group, meaning the underrepresented group, meaning Black, African American, Latinx, and Native American populations, as Mr. David quoted, 3.7 times to 3 times the rate for hospitalizations and deaths. We recently lost a wonderful family practice physician by the name of Dr. Susan Moore in Indiana from COVID. So it is very real. And one of the ways that we can effectively really combat this is the vaccine. In addition to continuing the 3 W's, which is to wear a mask, wash your hands, and watch your distance. I do want to let the community know as well is that, what's different from these trials as compared to previous trials, specifically, let's talk about the Tuskegee experiment where African-American males were prevented from getting a medication that could cure them from a particular ailment, in this case, syphilis. For these particular vaccine trials, it was multicultural trials, diversified trials, meaning that there were people from various backgrounds who were a part of putting this vaccine together and who, for lack of a better term, the vaccine was tested on. So that included Black folks, that included Latinx folks, that included some Native Americans. So it wasn't particular to a population. And those who, and people weren't withheld from getting something that actually worked in an unethical manner. The other thing to think about that I know is on many people's minds is why so fast? It just seems we've heard that vaccines can take decades to come to fruition. And what I usually explain is this is what happens when science really works and comes together. You have to think that COVID is one of the worst pandemics in the past 100 years that any one of us has ever experienced, and in particular our community, in the way of, even more so, we were affected to some degree, even more so than HIV in some aspects, especially in this current stance. And so it became a priority globally. So many scientists came together globally, many pharmaceutical companies came together globally. So for instance, the Pfizer vaccine is in combination with a German company called BioNTech. So this is one of the first times in history where we've seen scientists come together for one goal and one mission. And when you have that and you follow regulations and protocols, and there's not additional obstacles to get to the finish line, this is what happens. And so that is part of the reassurance. The other reassurance is that, during the trials, there were multiple different racial groups that were tested for the vaccine. The vaccine was tested through regulations in which it was supposed to be, did not skip any steps. And the most pertinent point is that we're dying from COVID, meaning the Black community. We are dying from COVID, and I'm witness to it.
Okay. I read somewhere that they needed more trials with Asian groups and African American groups. Is it indeed as effective on the Black community as it is for the white community? And either of you can answer that. How about we start with Chuck? Do you want to address it?
Sure. So in looking at the trial data, the vaccine appeared to be effective unilaterally across all of the groups. It's important to understand that when we see COVID deaths, the deaths and the hospitalizations as it relates to COVID, those are due to what we call determinants of health, or social determinants of health. And so social determinants of health are pretty important, because that's your health. When we think about our health is typically about 11% of what happens with us health-wise is really related to what happens when we see a doctor. The vast majority of our health is due to behavioral conditions, social conditions, and then our genetics. So luckily, thankfully, the vaccine appeared to be pretty effective across all ethnic groups. But because of our social conditions, individual behaviors, what we see is this clustering for mortality and hospitalization within the different ethnic groups.
Okay. Now, Dr. Sylvia, we talked back in January about the coronavirus and what parents needed to know. We spoke on this before most people in the United States were even concerned about it, So I want to tell our listeners to make sure they subscribe because we're on top of things before even the mainstream media, right?
You were. That was
right?
Superb. Yes, you were.
Yeah. But we're looking out here for the Black family and for the children. So I'm just going to encourage people who are listening or watching to hit that subscribe button and make sure that you stay on top of the news for your community and support us. I also suggest that you go and find the podcast because some of that information is still relevant today. You will also see how far we've come with the COVID virus and how much that we had predicted has now come true. So I just want to say that. Now, it's a mystery to most people what's in this vaccine, as it is for most drugs that we willingly take, like Tylenol. We don't know what's in it. We know it's acetaminophen, but we don't know what that means, okay? So in layman terms, how does this vaccine work? And is it a live virus? Can you address that, Dr. Sylvia?
Yeah, so I can address that. I'll start off by taking that I did receive, it's actually coming up to 3 weeks. I'm coming to my second shot. Coming up to 3 weeks ago, I did receive what's known as the Pfizer vaccine. That was the company that I said worked with a German company called BioNTech. The two vaccines that are currently out through Pfizer and Moderna, or we use what's called mRNA. So mRNA is a component, a piece of our cell machinery that helps to make proteins. So in order to even talk about vaccinations, we kind of have to talk a little bit about the immune system. So I'm going to back up a little bit, and I'm going to admit I'm a little bit of a nerdy geek. I studied biochemistry and immunology when I was in college, and I love how the immune system works. So we have to look at the immune system as it is our military. It is our defense. It's the defense for the body, the ultimate defense for the body, and it starts off with the skin. And it's an amazing machinery that we don't think about every day because we fight off germs every day in our bodies, and it's amazing how little we get sick because of our immune system is constantly fighting off bacteria, viruses, parasites. And it's only in those certain instances where the immune system may be worn down a little bit that we end up being susceptible. So kind of like the military that maybe doesn't have their guard up in certain circumstances and get susceptible to the enemy coming in. And so the immune system on its own does an incredible job fighting off infection and keeping us healthy throughout most of our lives. And there are numerous types of cells that help with that. But sometimes we need a little bit of help in fighting off the enemy, just like the military. For those who remember history, a lot of times multiple countries would come in this case of world wars, to help each other fight off a common enemy. And that's how I view the vaccine. That's basically what the vaccine is. The vaccine is a common friend that comes in to help boost our immune system, help rev up our immune system to fight off various infections. What happens when we're first introduced to an infection, such as a virus per se, the body sends off signals to warn the rest of the body that, hey, we have an intruder in here and we need to do something. And they get their resources ready to fight off that germ or particular virus in this case. And in bodies that the virus has never been before, it takes quite a while. It can take a few days to even weeks for the immune system to be able to fight off that virus adequately. And so that's why you see some people, particularly with the coronavirus, they get sick. Some people are able to fend it off quickly. Some people, it takes weeks. Some people, they get really, really sick because the immune system takes a while to rev up against it. What the vaccine does is to help the immune system identify that virus before the actual virus comes. So it actually acts like a mimicry of the virus. And so it enables the immune system to rev up against this fake kind of look of the virus. It's not the virus itself, and build up the tools that it needs to fight off the infection. So if the real virus comes into your body, it's ready to fight, and you're less likely to get devastatingly sick from it. So you asked specifically what's in the vaccine itself. And so many vaccines that we know, especially for parents in childhood, we're very familiar with the names of diseases like polio and measles. And we've heard the term live virus or live attenuated virus. What does that mean? And so when we started doing working on immunizations, about 50 plus years ago, or even we can go back 100 plus years, when people started to trial, they would take pieces of the actual virus. So the virus itself, either slow it down or like a live portion of the virus in small quantities, hoping that it wouldn't actually infect a human being, to basically get the immune system ready to fight off the virus in case if somebody got infected, the immune system would be ready and would be able to fight if there's a higher viral load. Issues with live vaccines is that if your immune system is not up to par, in part it is part of the virus, the actual virus itself. And so there is a small risk that the virus itself can infect your body if your immune system is not ready for it. What is different about the Pfizer and Moderna vaccines are these are not live virus vaccines. There is not a component of the live virus. There is a piece of the virus that is not alive, that the immune system thinks is the virus, acts towards it like the virus, so that if you were infected with the virus, you can actually fight it off. And so what do I mean in long term? And so what that means is that the viruses that we have affordable to us today for coronavirus cannot mutate into the virus or not become the virus within our bodies. That is not possible. That is different from vaccines from earlier days when we were first starting to learn about vaccines. And so it is pretty much impossible to obtain coronavirus from the vaccine itself. What I do want to clarify and where the confusion comes is, again, as I explained, the immune system, it does take a while for the immune system to get fully equipped and ready to fight off any germ. And so as you're getting vaccinated, in that process, if we're not continuing to practice our 3 W's, wash your hands, watch your distance, and wear your mask, and we happen to get exposed to the coronavirus or COVID-19, and it is possible, if that our immunity is not fully revved up yet, to get coronavirus from others within the population. But you're not going to get coronavirus from the vaccine itself. And so there's been news out there of healthcare workers who received the vaccine, but then got coronavirus. It's not from the vaccine. The vaccine takes quite a few weeks to work, and the vaccines that we have available to us, we need 2 shots, 3 weeks apart. And so you're really not immune until about 6 to 8 weeks after the entire process is done. So within that period of time, and Mr. Davis, you can correct me potentially with the numbers, but within that period of time, you are still somewhat susceptible to the coronavirus. But in all clarification, the vaccine itself cannot cause you to have, I should say, coronavirus.
Okay. Chuck, would you like to piggyback on that or anything that she said there?
Sure. Well, just one slight modification. In some instances, when you receive the vaccine, usually within 10 days or so, you produced enough antibody response to where you do have some protection. But at the same time, just like Dr. Owusu said, you absolutely have to still follow the 3 W's of watching your distance, wearing a mask, and washing your hands. One thing I would want to add is we talk a lot about vaccines, and vaccines are definitely a game changer. There's no question about it. The issue that we have really comes around the fact that this virus is behavioral. And when I say behavioral, what I mean is that what we do dictates the course of the virus. The virus isn't, a person. It doesn't have an agenda. It's not a Republican or a Democrat. It's a fragment, and our discipline really dictates what's going to happen, and also our social conditions. So what we see in the African American community and the Latinx community, I mean, typically the by and large, the working backbone of this country is that we oftentimes have to work. Oftentimes we don't have the same means to effectively social distance. So a lot of what we have to do is really around risk mitigation, figuring out that, or harm reduction, as we call it, figuring out if you do have to take certain risks, how can you best protect yourself and your loved ones. So I know it's somewhat of a tangent, but it's just so important to understand that what we're doing is really shaping the course of this pandemic. When it's going to end, for instance. Lots of people, wonder now that we have a vaccine, when is this going to be over? And it's really important to understand that, the new year has come. Just because it's 2021 doesn't mean that that COVID went out with 2020. Nothing has changed. It's still here, and we have vaccines that are just now coming on board, and we're still going through the tiers of distribution to get it to people. When you look at all of those things, and also the fact that we have people, again, behavior. Hey, 2021, I'm going to party like it's 1999, and people were out there and they were getting together, and so we're going to have a Christmas surge. That's going to happen because people did get together, they did travel. That's behavioral. That's a conscious choice that people made. And what happened is that, or what will happen is we're going to see increased numbers of death, and we're going to see, well, I should say backwards, we're going to see increased hospitalizations, and then we're going to also see increased numbers of death because people really couldn't follow the discipline of not getting together, and they did so in an unsafe fashion. The same thing is going to happen for New Year's. So we're going to have a surge on top of a surge, and then things hopefully will start to will hopefully get better. But all of the modeling that we're doing, because we look at behavior as well, tells us that we're going to be dealing with COVID in terms of the same level of response, probably till the fall of next year.
Wow. So summer vacations.
No, I wouldn't say that summer vacations are gone. It's just that things will get better because we're going to start to see vaccinations, but the vaccinations will come in tiers. So and the issue has been that the federal government basically financed these vaccines and the development of these vaccines, but and they come up with a distribution plan for those vaccines, but it's basically as though someone dropped a package off at your door and said, okay, basically, and I've heard a good analogy, I'm going to borrow it, where someone drops an IKEA some IKEA furniture off at your door and says, okay, I delivered the furniture, but you got to build it. And that's what's happened at the state level. So states are trying to figure out, how do we engage in this huge vaccination effort, something that at this scale that they've never had to do before. And then you have, how do we figure out what groups? And so we're trying to do it in ways where we're looking at health equity, trying to correct for issues in the past, making sure the right people get it. You've probably heard stories about rich people trying to jump the line and call their doctors and, hey, I donated money, so, I want to be able to get the vaccine, which ought to be a hint to us. If we see rich folks out there trying to get the vaccine, then I probably want that vaccine too. But it's complicated, and it's going to take time to work out. So we just can't say, okay, we're going to rely solely on a vaccine. A vaccine is a factor; it's a huge factor, and I would definitely encourage people to get it. One last thing, and COVID-19 has become the singular leading cause of death in this country. It's we just recently did some work and did a study, and it turns out when we looked at it locally, we found that COVID was 6.5 times the suicide rate. It was 8.5 times the homicide rate. When people say, "Well, COVID's like the flu," no, it's not. COVID, in the study that we did, it was 58.3 times more lethal than the flu in terms of deaths. And to do this, we looked at the death records for the last 7 years and looked at every cause of death, and then looked at COVID to see where it ranked.
Can you say that again, that number again? How much more deadly? Just so to emphasize.
58 times. So people
Wow.
die of the flu. I mean, every year, and we probably, know of friends or, older people that get the flu and die. But COVID has killed, at least in this study that we did, was localized, population of about 758,000 people. But COVID, and it's not even done yet, has killed 58 times the number of people that died of the flu. And just to give you an idea, we think about, well, I've heard people say things like, when they start to play amateur statistician, well, I could die in a car accident. Yes, you could. But COVID actually killed 5 times as many people that have died in car accidents. And by the way, it's just the transportation category. So that's car accidents, pedestrian versus car, boat, bus, plane, anything that you can get into to get you from point A to point B. If you died that way, COVID killed 5 times as many people. So this is real. It's not made up. It's not like, well, and I've heard other things like people said, well, they're making up the deaths. I've heard this at the barbershop, right? I mean, when I could go, they're making up the deaths. These deaths aren't real. They're saying everything is attributed to COVID. No, like I said, we've looked at the actual death records, and sure, someone might die of heart failure, but it is a cycle. They come in with COVID, they develop a pneumonia, they become hypoxic because they can't breathe, and then because they can't breathe, the cause of death is COVID, but the manner of death might be cardiac arrest. So it's all COVID. They didn't have the cardiac. They wouldn't have had the cardiac arrest if it wasn't for the fact that they couldn't breathe. So again, it's just really important to understand that there's so much misinformation out there and myths, and we're looking at the data and looking at how it affects our community, and it's real.
Right. Well, Chuck, you've been working on assessing COVID risks for state and local governments and working with others on vaccination priorities for certain individuals and communities, and to understand why minority communities have suffered the most. So in what you've seen so far, or what you're working toward, who is a priority besides the frontline workers to get this vaccine? Who should get it?
Sure. Well, I mean, obviously, to your point, frontline workers with respect to healthcare, because they have a lot of contact with people that have COVID. So if we lose our frontline healthcare workers, we're in deep trouble because we don't have people to be able to treat COVID. Next in line in terms of equity would be those people that are largely essential workers, and also older people, and people that are in congregate settings. So people that are in skilled nursing facilities, that's where we've had the majority of our outbreaks. So they're in that top tier as well. And then you can start to, and there have been different groups that are comprised of doctors, bioethicists, and the like that have gotten together to discuss these things. What our data is showing is that within the African American community, for instance, we tend to die younger of COVID. And the same is true in the Hispanic community. In the Caucasian community, for instance, COVID tends to affect men in terms of what we call severe disease, in larger numbers than women in terms of getting severe disease where you have a real issue. We're finding that in our data that women in the Hispanic community and the African American community, their numbers are higher in terms of severe disease as opposed to men when compared to other groups. So I really do think that in terms of equity, as we get to these different tiers, that we really need to look at mortality. If you have Black folks and you have the Latinx community seeing 3 times and 4 times the number of hospitalizations and 3 times the number of death, then maybe that ought to be the prioritization or part of the prioritization calculus that you use. And with a lot of the health metrics that people are looking at, that is the case, but it remains to be seen exactly how that's going to play out. So I think that in our community, we need to advocate for the vaccine, and we need to advocate and make sure that we ask for it and that we get it and that we make it a priority. And part of that is distribution to areas that are underserved. We talk about food deserts. We don't want to have vaccine deserts. We have to understand that within these communities, it's oftentimes harder to get to the vaccine. We need to look at efforts where perhaps we mobilize the vaccine and take it directly into the community. And so that's going to happen on a individual, localized way. I live in California, so I know that we have very specific efforts here. Somewhere else, they might not have the same infrastructure or the like. So it's going to be a patchwork just because we haven't had a federal plan to formulate how we roll this out.
Dr. Sylvia, in pediatrics, what have you seen regarding how the virus has affected children?
So great. So thanks for asking. I would like to say, in a kind of a bittersweet way, compared to most pandemics, overall, globally, and I could say locally within my jurisdiction, we are seeing more and more children who are being affected by coronavirus, but we're still seeing predominantly mild to moderate disease. So less so of children who require going into the intensive care units to get care, being put on a breathing machine. We're not seeing so much of that in the pediatric population still as much as we're seeing in the adult population. That being said, in the fall, a wonderful colleague of mine, Dr. Monica Goyle, did a study in the DC area and noted, again, there's a significant health disparity for children of color and the rates of the coronavirus and comorbidities within. And so children of color are more likely to get coronavirus. They're more likely to be sicker from coronavirus. And so health disparities still remain in the pediatric population, unfortunately. And so to Mr. Davis's point, we really need to hone in on our community on health disparities, education, looking at social determinants of health, mitigating vaccine droughts or lack of areas where there's vaccine, really talking to our community, because not only are our young adults being affected, but our children are being seen at higher rates still. And so that is still very concerning. And we already know when it comes to social determinants of health, many of our children of color already suffer significant comorbidities. And we talked about this about a year ago with asthma, right? And so children with asthma, Black children with asthma in particular, more so than any racial group, are more likely, about 3 times more likely to be hospitalized for asthma and have significantly higher death rates outside of COVID. The same goes for mental health, which we don't talk about a lot in the Black community for children. And so there's already numerous health disparities within our Black community for children that we were battling prior to COVID. And many have heard that COVID has been the great revealer. And unfortunately for us, the same health disparities we're seeing with COVID in children, meaning that we're seeing higher rates of those who are sick, children who get really, really sick from the coronavirus. And those children are children of color.
Now, we used to hear about at the beginning of this, or I would say midway through where we are now, that children were getting Kawasaki disease. And How is that? We don't hear about that anymore. So why is that? And is this still a factor? And I understand Black children we're getting that at a higher rate as well.
That is correct. And thank you for the opportunity for speaking about that. So what we actually, in medicine, what we call that is it's known as MISC, so multi-inflammatory syndrome of children. Short, you may hear MIS-C on the news. So in full clarification, what that is a post-inflammatory process for children who were previously infected with coronavirus. And so one of the criteria for that is a child who previously was positive for coronavirus, who now presents with symptoms similar to either Kawasaki disease or shock. And so I'll go over that real quickly. So Kawasaki disease is different than MISC. So they're similar, but they're not the same. So Kawasaki's disease is an inflammatory disease that affects the medium-sized vessels of the body. And some of those vessels, such as the coronary arteries, supply blood to the heart. Kawasaki's disease in particular normally affects the Asian population greater than any other racial population. And what happens is we don't know what particularly causes it. We think it might be a virus that triggers it, but it causes an inflammatory process in which you get red eyes and a strawberry tongue and a rash. And the scary part of Kawasaki's disease is that can cause inflammation of the heart and create heart failure in children with otherwise normal hearts. And so we watch out closely. So Kawasaki's disease has been around for a while. We watch out closely for that. What this post-inflammatory disease of coronavirus does is has a similar effect to the vessels in children's bodies and the vessels around the heart. And so these kids can go into organ failure and end up being really, really sick. And so they can look like a child who has Kawasaki's in the sense they may have the red eyes and the rash and the strawberry tongue and the swollen glands. But what's different is these kids had coronavirus prior, and now this is after the coronavirus has left. The body's kind of reacting to the damage that the coronavirus has left behind. The immune system is still kind of revving up and causes this, what we call post-inflammatory response. The other thing that can happen is kids can get really sick in the sense of their hearts beat really fast and they're what we call in shock or hypotensive. And so they don't get blood to the systems that need them, such as the heart and the kidneys, and all those organs begin to fail. And then they require support, intensive support in the hospital. We saw a lot of this at the beginning, particularly in New York and DC in the beginning of the pandemic. It's still very much around, and you are right, it affects children of color more, not so much in the news. Locally, I'm not seeing as much of this, but it very much exists. What I want to make clear is it's not the same as coronavirus. It's not like when a child is positive for coronavirus, gets this disease. This happens after a child has basically had coronavirus, it's post the infection. So it's what we call post-inflammatory process. So it's kind of like what happens afterwards. So a good example would be if before penicillin, when people used to have strep throat and they didn't get treated for their strep throat, a few years later, they might get what's called rheumatic fever. And you still get it in developing countries where the bacteria creates some inflammation and you can get heart disease and things of that nature. Now, because of modern medicine, we don't see rheumatic fever so much anymore, but this post-inflammatory process is kind of similar to that. Does it still exist? Yes, it very much still exists. Is it in the height of the media? No. Are there extremely high rates? No. Is there a health disparity? Yes. So children of color, once again, both for coronavirus and this post-inflammatory process are getting it at higher rates.
Okay. So Chuck, would that put children low on the priority for getting the vaccination?
Yeah, and Dr. Sylvia will probably be able to talk to this as well. But currently, the current vaccines are not indicated for children age 16 and under the age of 16. So children don't get the vaccine. And again, that's even more reason for adults to be responsible. I mean, as parents, what do we want to do? We want to protect our kids. Well, the best way we can protect our kids is to protect ourselves. get the vaccine so that we can protect our kids. There's no timeline yet as to when children will be able to receive a vaccine or even one of these mRNA vaccines.
Okay. Now, we heard about some side effects that are out there. What are they, and should we be concerned, especially for children that might get it later that are 16 and above? Is that a concern, Dr. Sylvia?
Yeah, so I could speak for myself, and I can speak for many of my colleagues that have recently received the vaccine over the past few weeks. So certainly, like many vaccines, there are side effects, particularly, within the first 24 to 72 hours, you can have fever, chills, muscle aches, and that's what a lot of us have experienced. I personally didn't experience that. My personal experience was that I had a very sore left arm, similar to what I would say similar to the tetanus shot, where it felt really sore, and I exercised that a bit. The next day I had muscle aches and pains. I went to work, but I did take some ibuprofen because I felt kind of icky. And then like a day or so later, had a little bit of headache and dizziness, and have felt fine since. Haven't had any kind of symptoms related to the vaccine that I'm aware of since then. A lot of my colleagues have noted and documented fevers, chills, night sweats, muscle aches and pains, some dizziness, maybe a little bit of in the way of numbness and tingling. But most of the people that I've talked to, all those symptoms have resolved. Actually, all the people that I have spoken to, can't speak for everybody who's received the vaccine, but for those colleagues of mine that I have spoken to and interacted with, all of those symptoms resolved within the 72-hour mark. Depending on the vaccine, there are certain concerns for certain types of populations. So you've heard that patients who may have a history of anaphylaxis or a severe allergic reaction probably should, during the trial, there was notable anaphylaxis for the Pfizer vaccine. And while being administered in Britain, there were at least, I think, 5 to 6 folks who had significant anaphylaxis or allergic reaction who were then subsequently treated and fine. So these are some considerations that we may want to have moving forward. The good news is as time goes on, we're going to have more in the way of vaccine choices. And so one or more vaccines may have one or more type of side effects more than the other. But I will say about the vaccine side effects overall is that compared to COVID, overall, it's been very mild to minimal, even with the trials. And I'll let Mr. Davis speak more, to the data of that. But that's been my experience.
Okay. Would you like to comment about that?
Sure. I mean, I think with respect to the vaccines, there's one other important note, and that is that the vaccine is not 100% effective within the population. So it's one of the reasons why this pandemic is going to go on for a little while longer. So if we use, for instance, the Moderna number and we say 95% effective, that means for 1 million people that receive the vaccine, 50,000 people, the vaccine will prove to not be effective or have a reduced efficacy to the point where they would still be potentially susceptible to COVID. So that's important to note. It's not 100%, but those numbers are still incredibly high, given that most vaccines are typically in the 65% range or so. Typical influenza vaccine, maybe a little bit higher. So it's really impressive in terms of what we've been able to accomplish with the vaccine. The last point is the side effects. They're largely manageable, like Dr. Sylvia was saying. The most severe that's been seen thus far has been anaphylaxis at least within the healthcare settings where the vaccines are currently being distributed. They have epinephrine, crash cart, all those things on premise. So if you were to have a reaction, a really, really, really bad reaction, you're in an environment where something can be done. and quickly, and you're watched after you're given the shot. You don't want to get COVID. Because even if COVID doesn't kill you, it's in terms of the numbers, your chance of death from COVID is relatively small. We still are still trying to understand what the long-term effects are. You've got people with their teeth falling out after they've had COVID. You've got kids, now showing up with something called COVID toes. You have people that are having myocarditis, and they're having issues with their heart and circulatory issues afterwards. It's just, since we don't understand it, why mess with it? If we have something that can protect us, and like we said before, knowing that young kids can't get it, we need to be able to protect ourselves.
Okay, let's talk about the mutations, because I call this new mutation the get it quick edition. because but the vaccine is supposed to be effective, even though the virus will mutate, as viruses do, right? Would you like to address that, Dr. Sylvia?
Yeah, so I will be fairly honest with you. There's not too much that I know about the current mutation. I know it's been this is eerily similar to our conversation a year ago, where I know it's in Britain, and there have been to be found some cases here in the United States. What I can say is that for the current strain, SARS-CoV-2, that we're dealing with here, and the rate of death that it's causing, morbidity or mortality, in conjunction with the 3 Ws and the vaccine, and to create a herd immunity. So for about 80% of us to get the vaccine and continue practices, I think we're still going to be able to slow this curve. It does go to show that viruses are tricky little beasts, and that we should be on the lookout and gather some more factual information as it comes as to the mutation. And this is why it is very imperative to continue doing the public health practices that we're doing as we begin to figure out what's going on with this mutant strain and how it relates to the vaccine. Because until then, what's really going to protect us are the public health practices, the wearing the mask, the washing the hands, the keeping the distance, the minimizing the social gatherings, as mentally, health-wise hard as that is to do. Those are going to be some of our surest ways to continue to keep our community safe.
Let's talk about some of those behaviors, because you kind of addressed it earlier, Chuck. I know as I scrolled down my Facebook timeline, I saw families getting together minimally 10 thick with no mask on, elders in the room that are vulnerable, just through caution to the wind, it seems anyway. I know many of us have been tested before we go out to visit family, but I saw someone write, it was Dr. Kay Dingwell from Canada. She said using a negative COVID test to decide if it's safe to go to parties is like using pregnancy test as contraception. So let me just say that again for the people listening. Using a negative COVID test to decide if it's safe to go to parties is like using pregnancy tests as contraception. So that kind of, made me think, wow, a lot of people are doing that. They're saying, I got a negative COVID test. I can go and visit my mom now, or I can go and visit grandma, or I can go to this party because all of us got negative COVID tests. We start with Dr. Sylvia, can you address that? And then Chuck, I want you to talk about the behaviors that you found, because I'm wondering, will we ever get this under control with the behaviors that we as Americans are used to, doing on our daily basis, that maybe we just can't behave?
So there's a couple things to that. One, you're right. So what's really helpful in the way of testing is knowing that you're positive. Negative testing. So I'll give you an experience. I had a patient. I had a young patient who came in and had COVID-19 exposure. had a little bit of symptoms in the way of like cold symptoms, got tested, was negative. The symptoms persisted, came back literally within 48 hours and tested positive. Right. So symptoms worsened. And so what does that go to show you? So the test is a snapshot in time, right? Just that snapshot in that instance, whether you're testing positive for COVID or not. In order to test positive, your viral load has to be to a certain quantity. It has to be a certain amount. So you could still be technically have the COVID virus or just have been introduced to the COVID virus, but your viral load is not big enough to be detected on the test. So you're tested negative. And so that's why in this case, this particular patient tested negative 2 days prior, but was persistent, had worsening symptoms and came back and was tested positive. Now imagine if you tested negative 2 days and then went down to Disney World with his family for vacation because he tested negative, and actually was positive 2 days later at the, one of the largest theme parks in the country. So we have to be, very careful in the way that we look at testing and what it does and how it serves its purpose. I kind of always look at it as, if you test positive, that's extremely helpful. If you test negative, it doesn't mean that you're out of the woods quite yet, because it's literally a tiny snapshot in time. And it can, the test that we have currently can only pick up to a certain viral load. And so if you haven't reached that yet, it doesn't mean that necessarily you don't have COVID. And so that's something that people really, really, really need to think about, even with a negative test, that it's very imperative that we continue to do our public health practices.
Okay. And Chuck, are our privileges and sense of freedom getting in the way of eradicating this virus?
Oh, yeah. Yeah, that's why we're, as a country, we're setting new records, per capita. And to Dr. Sylvia's point, she's absolutely correct in what she's saying with respect to the behavior. I mean, behavior is what drives this virus. And to your point, can we behave? The reason why the vaccines are such a big deal is because it's the first time where we haven't had to rely on everybody doing the right thing. And so when we look at different communities, and I'll share a story now. My wife is a physician as well, and she's Latina and works very heavily in the Hispanic community. And we were looking at COVID and positive cases within both the Black and the Hispanic community. And what we found is that the behaviors are very, very similar. So, in Black families, Hispanic families, we like to get together. A lot of our community is around, food and gatherings. It's the way that we show our love. And so what was interesting is that when we did the outreach and started confirming certain cases, we worked with a bunch of community-based groups. And one of the things that we did in addition to testing was we also did surveys to actually understand what was driving the behavior and to understand what the perceptions were. Because a lot of our behavior is based on a perception, and the perception could be wrong. And so one of the perceptions was, well, I don't go to other people's homes and do things with them, but it's okay. I mean, but I just see my auntie or I just see my tia, and that's okay because they're a family member, so they're safe. I know how they live, and still wind up catching COVID. So you can't assume or approach being safe. No contact between households means no contact between households, and it's incredibly difficult. It's hard. It's especially hard in our community because a lot of times, we have that big extended family with the grandmother or grandfather and combined care. It's really, really difficult. That and also our social circumstances. So if we do get exposed and we do have to and we do have to social distance and quarantine within the home. If we live in a smaller space, or if we have a larger family, that's harder to do. We did a study where we looked at the people where the transmission was rampant throughout the households, and we found that there was like this magic number of 2,000 square feet and less of the living space, and there was the direct correlation to how fast and the likelihood that people within the household would get it. Now, it's common sense. If you live in a smaller house and you don't have an extra room where someone can isolate themselves while they have COVID, then you have a greater risk of spreading it. So these are the things that we need to make sure that we're aware of within the community. If you do get COVID, all is not lost, but then how do you prevent other people within your household from getting COVID? And those are the kinds of discussions that I really don't hear happening at with the same level of volume and frantic concern as some of the other conversations. If you get it, how do you prevent everybody else from getting it? I think that's important.
Right. Chuck, let me ask you, the last number that I saw was that Black Americans were 4 times more likely than white Americans to die of COVID-19. Is that true? Or is it a different number?
It's a little bit lower. Well, it depends. The national number is 2.8 times more likely, but that's an aggregate number across the United States. If you go to a particular community, parts of Chicago, parts of California, where I live, that number is much higher. So it's really the thing about a pandemic is you can look at the general numbers, but really a pandemic is a bunch of little epidemics. And so in each community, you'll have a different rate of death because it's the composition of the community. If you take a particular area of Chicago, which might be predominantly Black, then the death rate might be 5 or 6 times as much. So it really depends on the demographics of a given area. But to answer your question, once again, in aggregate across the United States, that number on average is about 2.8 times.
Okay. All right. So, Dr. Sylvia, let's talk about Dr. Susan Moore, because you leaked her story or told her story. Can you tell us what happened to her and why her story is significant?
Yes, I can. And so, want to, start by thank you for the opportunity to talk about Dr. Susan Moore. I did not, want to start off with, I did not know her personally, but, I don't feel like we need to tell the story. And I thank you for the opportunity to tell the story. And I pray that let her family know that we are praying for them, in particular her 19-year-old son. And we're blessed to have her in our community, meaning the medical community. And so twofold or manyfold is the Dr. Susan Moore story is very important. One, she was an African-American female family practice physician. And so in that, she unfortunately meets that quota of our Black communities dying at higher rates, particularly African-American women, of the coronavirus, of COVID-19. So that's one of the more obvious things about the death of Dr. Susan Moore. What's equally as tragic is her treatment on her way to leaving us. I am part of a group called Physicians Mothers Group on Facebook. And she was part of that group, and we share with each other many things related to family, related to medicine, as you can imagine, related to a lot of things, and help one another out in many, many various ways. What she began to do is chronicle her experience as an African-American patient in the hospital system where she worked, of how she was being treated. And that was the even more troubling, I think, aspect of this. So particular examples that she brought out was that she had COVID-19 and she was extremely sick. She had known lung disease. She had significant neck swelling. Her glands in her neck were swelling, and that's something that COVID-19 can do. It can cause swelling of your lymph nodes or your glands throughout your body as your immune system revs to kind of fight it off. And so she was in a lot of pain. And on top of that, she had the COVID-19 pneumonia that Mr. Davis briefly mentioned earlier. So she was in a lot of pain. COVID causes a lot of pain. It causes a lot of muscle pain and aches. I hear, so that's where you cannot compare it to the flu at all. And she asked for pain medication. And she was seen as a pain-seeking patient, in which a lot of our patients of color have to deal with that on a regular basis. And it's not brought into the light, particularly patients with sickle cell disease, who, if anybody requires pain medication, it's a patient who has to deal with a lifetime of bone pain, because bone pain is one of the worst types of pains. But even within our sickle cell community, a lot of our patients have to deal with that, the idea of pain seeking in the midst of this opioid epidemic. And so I have strayed a little bit. So that was one of the caveats that she chronicled, was that she asked for pain medication, and she needed it. And she was told that they thought she was pain seeking. They told her they were not going to give her the intravenous version, which is a stronger version of the pain medication. They could give it to her the version which she could take by mouth. And then it took up to 4 hours to even get the pain medication. And that was just one of the many examples of how she was, treated differently as an African-American female, and how we could see these insidious signs, or not so insidious signs, of systemic racism in medicine that we still deal with on a regular basis. And hearing these stories as she was gasping for air. I mean, when you watch these videos, she's taking deep breaths in between telling the story. You could see she's in distress. Telling the story. And in the midst of that, to hear that the nurses and the physicians that surrounded her were not treating her equally or as a human being, as a patient, and knowing what we deal with systemic racism in medicine is very heartbreaking to watch. It was not only the nurses that gave her a hard time, but the physician as well. And here she was, a physician. And not to say that, people of certain education status or socioeconomic status or professional status should gain more or better health than anybody else. But the sadder and scarier part is for those who don't know enough to speak up for themselves, whether it be a language barrier, education, or just not being familiar enough with the disease process. How many more of those stories have gone untold, specifically during this COVID-19 pandemic, where they weren't getting the justice and the care that they deserved? And so in her death, we appreciate her speaking up for our community and speaking to these things. And these, again, COVID-19 being that great revealer, that on top of having to deal with coronavirus, still having to deal with being Black and systemic racism in medicine, was her powerful story that needs to be shared with the world. We still have a long way to go in that arena.
Right. So, this is even more of a reason to get the vaccines. We have to deal with not only the symptoms of COVID, like you said, but then the systemic racism on top of that. So getting the vaccine, hopefully, you can keep from having to experience any of those things. But it's going to take a while, like you said, the rollout to get it. So even people like me, I'm going to have to wait a bit to probably get this vaccine. Hopefully with the new administration, they have their plan for rollout that will distribute all 3 vaccines pretty quickly. Now, just to go back a little bit, because I want to make sure we answer everyone's questions. Since it's not a live virus, they can't shed it to anyone else, correct? Just let's answer that definitively. Can it be shed or not, Dr. Sylvia?
No, it is not a live virus, and it cannot be shed. You cannot get coronavirus from the vaccine. Again, when you hear media stories of people getting coronavirus after they got the vaccine, it's because they got it from the usual routes of getting the coronavirus and not from the vaccine itself.
Exactly. Okay. So let me ask you if there's anything else that's important to know about this virus, specifically for Black families, that either you would like to speak to. Please, this is the time to do it, because we're getting to the closing of the show. Anything that you may have run across or you want to speak on, let me know. Chuck, did we miss anything?
I would just say, I think for parents that are trying to, especially as Black parents dealing with our children, it's important for us to model, the behavior. I mean, I've got 2 boys, and I've had to have the talk with them about, their behavior and how they're perceived. If they ever do encounter law enforcement, that's just, that's our reality. And the same is true for this virus. My kids, they want to, they're active in track and football and fencing and all kinds of stuff, and they want to see their friends, and I get it. And when you're, a teenager and you're young, the whole world revolves around, your social experiences. And it's been hard to be able to, to tell them, hey, listen, we need to exercise some discipline. And as hard as it is, we're going to have to make some sacrifices. There are certain things that you can't do because there's a risk. There's a risk to me. There's a risk to your mom. There's a risk to your grandmother. And they understand that. But I think that modeling that behavior, we didn't say, well, you can't do these things and then show up on Christmas at my mom's house for the gumbo fest. I went, but I picked up the gumbo and I brought it back. We didn't sit there and eat the gumbo. So we have to learn to do things differently to protect ourselves. And I think that that's critically important. This is an opportunity to be honest with our kids about discipline and about sacrifice, as hard as it might be, and truth about what's really happening with respect to this virus, and when things will get better, and that we have a certain amount of control. I think a lot of us have felt out of control, and the fact of the matter is that if we exercise a certain amount of discipline, we can start to feel like we have a little bit more control, and we'll get through it. Things are definitely going to improve with the vaccine, because we don't have to rely as heavily on behavior, but it doesn't mean that we can just do whatever we want to do the way we were doing it before. We have to stay the course.
Thank you for that. That was great advice. How about you, Dr. Sylvia?
Yes, that was excellent. What I would say to parents is, we need everybody on the team. This is a situation where we need everybody's help. We need everybody to practice the 3 W's, as hard as it is. And is equally poignant to note is everyone's having a hard time. We're all having a hard time with this in one way or another. 2020 has been a pivotal year because of that. And so, no, it's not just you and your household that wants to see grandma and grandpa and mom and dad. I didn't get to see my parents this summer. This holiday season. But it's literally life and death is in our hands with this pandemic. And we literally have to see it that way. It is a matter of life and death. And if I had the power to choose to a certain degree, I would choose life if I could. Life, not just for myself, but for my loved ones, for my family members. Remember, children right now are not approved for the vaccine. The only way to protect them is doing the 3 W's and what we call herd immunity. So getting about 80 to 90% of the population vaccinated to protect those who will not be able to get the vaccine or can't get the vaccine right away. Those include cancer patients. So those of you who have family members who have cancer patients who are on chemotherapy, the vaccine was not tested on pregnant women. So there are pregnant women who are not opting to get the vaccine as well because of the lack of science and information behind it. So those are people in our community. And we know for the Black community, we have a higher infant mortality rate without COVID-19. We have a higher rate of pregnancy complications for African-American females without COVID-19. And so we need to do our best to take care of one another. I have been personally chronicling on social media my experience with the vaccine, so people could see a live person that received the vaccine and what are the side effects and what does it really do. And I encourage everybody to inform themselves, as in the case of what we're doing now with the Back Talk show, with factual data from experts, not necessarily from your auntie or uncle who read something from some other magazine, but factual data to arm yourselves like you would in any other healthcare matter. But we need each other. The only way we're going to get rid of COVID is not just through scientists. It's not just through healthcare. It's one of the only pandemics where you need the entire community to combat this thing. And we are dying, and it is real. And so literally power to the people. Let's get rid of this thing.
I want to thank you both, Dr. Sylvia Owusu-Ansah and Chuck Davis, for coming on Back Talk today to talk to us about the COVID-19 vaccine for Black families.
Thanks for tuning in to Back Talk by Successful Black Parenting Magazine. We'll see you soon.